Generally, your surgeon will need to remove the lymph nodes from under your arm to detect whether any cancer cells have traveled from your breast to the underarm lymph nodes. This information is important for your treatment team to know in planning whether you need any further treatment after the surgery. When all the breast tissue and nipple and areolar complex are removed, along with the lymph nodes under your arm, we call this surgery modified radical mastectomy. Typically, between 10 to 30 lymph nodes from your underarm, called axillary lymph nodes, will be removed. Usually, the underlying chest muscles are left intact. If your tumor is small enough and confined to one area of your breast, you may be a candidate for a new procedure offered in some medical centers called Sentinel lymph node biopsy. The sentinel node is thought to be the first lymph node or group of nodes in your armpit that receives lymph fluid from the area where the cancer is located in the breast. Your surgeon may pinpoint the location of the sentinel lymph nodes in your underarm in two ways. One way is by injecting a harmless radioactive agent into your breast around the tumor site. This procedure is done in the nuclear medicine department either the day before surgery or several hours before your operation. A second way is the injection of a small amount of harmless blue vegetable dye into the same area in your breast during the surgical procedure. If the blue dye procedure is used, you can expect your urine to turn a blue-green color. This is nothing to worry about and will disappear over the next few days. The surgeon examines the tissue under your arm, called the axilla, to locate the sentinel lymph nodes that have become highlighted with blue dye or with radioactivity. One or a few of these sentinel lymph nodes are removed and typically sent to the pathology department for an immediate examination under a microscope while you're still in the operating room. If the sentinel node is clear or free of cancer cells, your surgery is complete. No further lymph node dissection may be necessary at this time. If the pathologist does detect any cancer cells in that sentinel node, your surgeon will remove several more lymph nodes from your axilla while you're still in the operating room. Sometimes additional laboratory tests performed on the sentinel lymph node or on the remaining breast tissue reveal the presence of cancer cells after your surgery. In this situation, your surgeon may recommend more surgery to remove more axillary lymph nodes for analysis.